see if I could, improve it, but it was inevitable.
That's work. He hasn't timed it bad with Christmas next week, so
Yeah.
I'll just wait for that referral to come through. You know the wide's keeping well?
Yeah, okay. But had some teeth problems, but we're getting near the end of them. I've got to have a couple of extractions surgically next week, just before Christmas.
Inviting to a turkey.
Yeah, it's part of getting old.
I can see your eardrum. I'm going to mop up around the edge.
I suppose what I've been doing is at least softened it up a bit, maybe.
If I'm honest, it's always soft when you come anyway, so it hasn't really made the procedure easier for me. So you need ENT to look at your eczema of the ear, and it's all this dead skin that's shedding, and the skin getting trapped inside your ear canal, and the skin becomes damp and moist and wet, and it just doesn't migrate, and it blocks your ear. And all these drops that you use, it's not really going to do much. Well, the drops that you're using anyway, they're not prescription medication. You need some proper prescription medication. Have you been using the ear calm?
Yes.
How often have you been using that?
The ear oil a couple of times a week.
Not the ear oil. The spray called ear calm that I've recommended in the past.
Oh right, yes, we've got that, and I was going to start it after this time now.
Okay, yeah, okay. So start it after today, because that's slightly acidic. It's like vinegar.
Yeah.
And acidity is good for the ear. The ear should be acidic anyway, and when you've got your condition, it turns, your pH in your ear turns from acidic to alkaline, so that spray will help re-acidify your ear.
Oh.
And acidity is good, it inhibits certain bacterial growth, you see.
Right.
And fungal growth. This is really narrow, so I'm just squeeze in your ear. Got better already. It's so narrow, it's hard to even get the instrument in one part, but I managed to get through it.
Good.
Just a bit more.
Had you got a drill?
Yeah, widen it for you. It's a bit tender. I just want to get as much dead skin out as I can.
Yeah. Yeah, I don't know what to do about that. When my wife was cutting my hair last week, she said there's a lot of dry skin in your ear. So.
And this is that eczema I was referring to. It's called otitis externa. So that's why we sent the result to ENT.
I would have thought that the oil would have helped the dryness, but...
The oil can, but I think the ear calm's going to probably help you a bit more. That will re-acidify the ear.
Okay.
Some oil is slightly acidic in pH, but not so much as ear calm. The acetic acid is like, I think, 3 on the pH scale. It's really acidic.
Yeah.
So I would use the ear roll in conjunction, say, once a week perhaps. That will provide some moisturising and lubrication effect.
Yeah. So you're saying that the Boots ear cleaner is really not a good thing to use?
I don't think it's going to make much difference.
Or the Audi Clean. Yeah. Because they're different.
If you look at the fine print of the Audio Clean, you'll be quite surprised. It tells you not to use if you've got a blocked ear. So they advertise it to kind of clean your ear, but it says don't use it if you've got a blocked ear. It's really peculiar.
The contradictory.
The fine print you've got to look at.
Yeah.
So, let's get this one done.
Consultant. She always used to call them Sir.
Unlike that, I call all my patients Sir or Ma'am or Mrs.
Yeah.
But you most certainly can call me Neil, that's no problem. Any snow, I don't think, have we? So
no, not yet.
I think I'll just rinse it, haven't I? Yeah, it might be a bit tender in your ear. You're going to have to stretch it open if it's really swollen.
Actually, the snow still bothered me, even though years ago it might look pretty on the trees for 5 minutes.
It's all aesthetics, isn't it? I think everyone would like a white Christmas, but just for one day.
Yeah.
I know when I was young at school we used to love obviously snow days. Partly just snowball fights, but sometimes you'd have to go to school.
Yeah, my 2 Westies love the snow. They rolled around in it.
Clear the occlusion, there's just a lot of dead skin, so it's quite narrow. So I'm just going to go with a different instrument to mop up. Isn't it? So it should last, it should last you till the new year. I'm open anyway, so I'm here.
And we'll see if we can get that appointment sorted straight after Christmas.
We're going to chase up your doctor.
Yeah, I'm going to...
I think you've got a copy of the letter as well. So
yeah. We went completely private and had it done, but she's on his list now to have the other one done in the NHS.
Yeah.
So...
trying to mop up as much dead skin as I can from your ear.
Thank you.
If it does get a bit uncomfortable, let me know.
Time and I sleep on the right side and I can't hear anything. Phone goes, front door goes.
Has its benefit, not being able to hear in certain situations, of course. So I'm not sure my phone's keeping... I'm just being a bit to be as meticulous as possible with your ear because I know it comes back so frequently. I just want to get out every little aspect that I can comfortably for you.
Okay, thank you. Yeah.
That is possible to do. I'm a turkey. I enjoy cooking, so so this year we're not going to be celebrating the normal way.
This will be the first Christmas we've been home for about 12 years.
Oh, okay. Where do you normally?
We've always been away cruising.
Oh, well, it's a nice place to be at the moment cruising, isn't it?
Yeah. Usually.
If you're...
Yes. Yeah.
Sorry, the lens has got a bit blurry. It's a bit tender. I think we're about there. Let's mop up near the entrance and we're all done. I wouldn't say we produce more wax as we get older, but that you possibly lose your ability to naturally shed the wax, and because wax normally comes out by itself, it migrates. So as we get older, the earwax becomes generally drier.
And you get lots of hairs in there.
Yeah, and the hair can mat against the wax, but in your case, you don't have, yours is not earwax, yours is just dead skin.
Right.
And the dead skin is accumulating because of your eczema. So
right.
If you can get your eczema under control in your ear, what we call otitis externa, that will, because obviously with the otitis externa as well, your ear canal is inflamed.
Yes.
So by treating the otitis externa, we can reduce the inflammation hopefully, so the dead skin can migrate, and then you won't get as much dead skin anyway because obviously the eczema is being treated too.
Yeah. Yeah, that cream that the ENT doctor gave me last year to help with this inflammation and itchiness, that really works. It's really good.
That's why I want to get you referred back to the ENT so they can you can get that prescribed and hopefully be seen by them regularly. And they can discuss some of the bone conduction hearing aids and the middle ear implants you know, the ones that you can't wear a conventional hearing aid at the moment because of your chronic infections. We can discuss all that with them at the same time. So that's a two-purpose referral for the eczema, but also if the eczema doesn't resolve, a plan B so you can wear your hearing aid. So if you can do some sort of bone conduction hearing aid or middle ear implant, it's suitable.
That would be good. I mean, I spent all that money and it's just been a waste because it was the wrong type for my condition, really. I was sort of disappointed that the audiologist was more interested in selling those than actually saying something like, well, really, they're not going to suit your condition, you know.
You think you've got a small invisible hearing aid, haven't you?
Yeah.
To be honest, whatever hearing aid you're going to wear would have caused problems. The most suitable would have been an open fitting hearing aid, but that again would need a lot of maintenance, and it may not have been suitable for your hearing loss. So let's just hopefully see what this referral does. And
yes,
brilliant, all done.